Hello everyone and welcome back to another anatomy tutorial. This is Dr. Ahmed from the Veterinary Anatomy channel. Today we will talk about the anatomy of the heart of the sheep in detail. So let's get started. Guys, before we start describing the different parts and different structures of the heart of the sheep here, I would like just to remind you about the importance of this organ. So the heart, it's a very important organ, responsible to supply the whole body of the animal with blood. Blood means, nutrition and oxygen. So the heart is located within the thoracic cavity. Where exactly? Within the mediastinum. Where exactly? Within what's called the pericardium. Pericardium, it's like that sac surround the heart completely, and we describe it in another video. If you want to know more about the pericardium and mediastinum, please watch the related videos. So, as we said before, the heart is located within the mediastinum in an oblique way somehow, with the apex pointed toward the sternum a little bit. The heart in general has a base. So here in this area is the base of the heart, while this one here is the apex of the heart. The heart, we can also describe this border here as a cranial border of the heart, while that one here, the caudal border of the heart. Okay, so that means this is caudal and here is toward the head, and we have a left view of the heart of the sheep in my hand now. So some people may think that the heart has a front and back side, so this is not the case in the veterinary anatomy. In the veterinary anatomy, the heart, we describe the heart having two surfaces or two faces, the one to the left and the other one to the right. So the two surfaces, they have specific names, of course. So the left surface of the heart, we name it as the auricular surface or the auricular face. So this face here, the left one, is the auricular face, while the one on the right side here is named and called the atrial face. So this here is the atrial face of the heart. Let's go to the auricular face again here, and let's find out why we name this face as auricular face. Auricular, this word comes from auricles, which means like a little ear. Where can we find a kind of little ear in this view? We are talking about this part here and that one there. So this structure here, it's a kind of pouch extending from the atrium, like a kind of pouch extending from the atrium, the same for that one here. Looks like, if you agree with me, like a small ear, and that's why we name it as auricular cordis. So we have two auricular cordis. So this one is the left auricular cordis, is an extension from the left atrium there. We will talk about it later. And on the other side here, we have another little ear here called the right auricular cordis. If you move to the side here, you will find that this right auricular cordis is an extension from the right atrium. Back to the topic. So why auricular face? Auricular face because anatomists found that in this view, in this face, you can see clearly both auricular cordis, both auricula at once. And that's why they named this face as auricular face. What about the other name here? So the other face, the right face, the right surface here called the atrial face. Why did we name it as atrial face? Because if you agree with me here, this view is more closely related to the atria here and there. So in this area here we have the right atrium. This one is the right atrium. And that one there is the left atrium. So in this view, we can see both atria, and that's why they named this face as atrial face. So from now on, I hope it's easy for you to remember the names of the surfaces or faces. If you can find and see the auricles, so you are looking at the auricular face, while if you cannot see the auricles, but you can see the atria there in the dips, that means you are looking at the atrial face. Anatomists, they use these face names, to remember and to be able to describe some other structures, which we are going, of course, to talk about during this video. So now let's move to the next step. So the heart itself has four chambers. Two atria here and there, and two ventricles, 4 chambers. The atria are located up there, and the ventricles are down. So atria, what does it mean? Atria is a plural of atrium. So we are talking about 2 atria. We have here the left atrium, while we have on the other side the right atrium, from which, as we described before, we have these pouches, these extensions, the right and the left auricular cordis. The atria could be considered as receiving chambers. What does it mean? So they receive the blood coming toward the heart from the body or from the lungs. So we will talk about this. So you can consider the atria as the entrance to the heart. So the left atrium receives blood from the lungs through what's called the pulmonary veins. So here we can see the pulmonary veins. By the way, we have several pulmonary veins, as you can see, coming from the lungs, bringing the oxygenated blood from the lungs to the left atrium. While the right atrium, and now we will move to the atrial face here, the right atrium receives blood from the body. Where from the body? From the head and neck and the forelimb through the cranial vena cava, and from the caudal part of the body, including the hind limbs, pelvic cavity and abdominal cavity, through the caudal vena cava. So both of them transport the deoxygenated blood to the right atrium. So we talked about the atria. Now we can move to the ventricles. So there are 2 ventricles. The left ventricle is here, located caudally. Again, this is cranial, this is caudal. So this is the left ventricle, while this one here next to the cranial border is the right ventricle. Guys, we need to remember this. So left ventricle and right ventricle doesn't mean that the left ventricle is located on the left and the right is located on the right. No. In this case, in animals, the right ventricle is located cranially, as you can see there, all the way. This is all, yeah, the right ventricle, and the left ventricle is located caudally here. In general, the function of the ventricles is to push the blood toward the body and toward the lungs. When we talk about the right ventricle pushes the blood through the pulmonary trunk to the lung, left and right lung, which are located within the thoracic cavity, so nearby. While the left ventricle pushes the blood to the whole body through the aorta, that one here. So the left ventricle has to push the blood all the way to the hind limb, to the head, to the forelimb, so away from the thoracic cavity. And that's why we can notice that the left ventricle is bigger, thicker in wall, and stronger, as it has to push the blood far away from the heart. And that's something you can easily identify by comparing the left and the right ventricles. So if you just look at them, you will find first that the left ventricle is bigger comparing to the right ventricle, in the way that even the whole apex of the heart is formed by the left ventricle. So it is huge. Can you see? This is all the left ventricle. Not only this, so here we are talking about muscle, guys, yeah? So it's the myocardium, it's the muscle of the heart. So the thickness of the muscle of the left ventricle is much thicker than the wall of the right ventricle. So later we will open both of them and you will see what we mean. The thickness of the wall is much bigger here comparing to the right ventricle. But for now, you can even check this by pressing on the two ventricles. So now if you press on the left ventricle, it is strong. It's solid somehow, while if you press on the right ventricle, can you see? Can you see? So it's really very soft, yeah? Let me show you here. Can you see? It is thin comparing to the left ventricle. Okay? So, as we said, later we will open both of them and we will study the structures which we can find inside the ventricles. They are very interesting structures. To not forget, actually, the two ventricles are separated internally there by a septum. So there's a septum in the middle there, inside. We cannot see it from outside, of course, separating the right from the left ventricle. Where is this separation? How can we find it? So in this case, even in the external view here, we can look for what's called the grooves. So here between the right and the left ventricle, you can see this groove here with some blood vessels moving inside it. This is the level of the septum, which is located inside. So this groove is the border between the right ventricle and the left ventricle. If we move to the other side here, we can have also, or we can find another groove. This groove here, it's also located between the right ventricle, can you see? And the left ventricle. This groove here. So as this groove is located between the ventricles, so anatomists named this groove as interventricular groove. Let's break it down. Inter means between. Ventricular refers to ventricles. Groove, this is the groove. So interventricular groove. We have one here, one there, and even in ruminants we have a small one here. To differentiate between these grooves, we have to give them names. Do you want to learn more about these grooves? By the way, there is another groove here at the base of the heart. Yeah, very interesting, where we have the coronary arteries to supply the brain, the heart. So if you want to know more about these grooves and the importance and the function of them, make sure to watch the next video where we are going to move forward and describe the grooves and some other structures of the heart of the sheep. So make sure to watch the video. Make sure to subscribe. Make sure, please, to share this video with your friends. And if you have any question, please write them down in the comments. And before we leave, as we agreed previously, I would like to ask you a few questions. For this, so it's a quiz time. For this video, the first question will be, what is the name of this artery here? What is the name of this artery here? This is question number 1. Question number 2. What is the name of that structure here? Can you see? It's a kind of ligament moving between this, I will not tell you the names, between this artery and that artery. So question number 2 will be, I will move it to this side. What is the name of this structure? And question number 3, let's make it even more difficult. Yeah, because I know that you are all best of the best. So what is the name of this blood vessel here? This one here in the sheep. So this is question number 3. Please write, the answers in the comments, and I will check on them and let you know if you got it or not. Of course, to get some information about all of this, we have several videos related to the anatomy of the heart. Watch them and see you in the next video. Bye bye for now.